Welcome to Plant Your Seed. I'm your host, Fred Ferris. On each episode, we share stories of how ordinary people have transformed their lives. Each story is compassionate, each story is authentic, and each story is a transformation. Here are the stories of the people who are changing our world by transitioning to a plant-based diet. Today on Plant Your Seed, joining us from California, we have Dr. Richard Schmidt. Dr. Schmidt is a reproductive endocrinology and fertility specialist. He has committed more than 25 years to delivering excellent patient-centered fertility care and is passionate about helping patients achieve better outcomes through a plant-based diet. Welcome, Dr. Schmidt.
It's great to be here. Thanks for having me.
Thanks for being here on Plant Your Seed. What is it that people interested in having children need to know about a plant-based diet and its relationship to fertility?
I think nutrition is probably the most underrated tool in the toolbox for being able to achieve a healthy pregnancy.
Mm-hmm.
We rely on these wonderful apps that we have now. We rely on medications, and so much is really right back down to what's going into the mouth, what's going into your body. And bathing both the eggs and the sperm in loads of antioxidants is so powerful for reproductive health. And so I try to make it a point with my patients to do the check on their diet. And it's not so much that I guide them away from animal products, but if I guide them towards the diet that I would like them to do, it would be pretty tough to fit in too many animal products, and hopefully they'd be on their way to a whole food plant-based diet. And that's really fruits and vegetables and whole grains is just the way to go. Just that combination, it gives the gametes just everything they need to be bathed in continual wonderful fluid that they need to reproduce the best.
What is the difference between a plant-based diet and other diets that eliminate, say, poor food choices like soda and processed foods?
I think the big difference in a plant-based diet comes from that question that I get as a whole food plant-based person. I always get this, where do you get your protein? And for me, my question to my patients that have that kind of mixed diet or maybe heavily animal-based is, I ask them, where do they get their antioxidants? So I think that's the huge difference. We all know that animal products have basically zero antioxidants. And what we need is not, I would say, an overload, but a high load of antioxidants, which we're going to get from fruits and vegetables.
Now, what has your experience been with patients' fertility and a plant-based diet?
My whole journey down why the antioxidants or anti-inflammatory foods would be so helpful really came from having an abundance of patients with endometriosis, which is a process where the lining of the uterus, instead of being where it should be inside the uterus in the normal place, the uterine lining, it's actually finding itself outside of the uterus. Maybe that's inside the fallopian tube or on the fallopian tube, on the ovary, could be on the bladder, anywhere in the pelvis, and sometimes outside of the pelvis. And that whole process is an extremely inflammatory process. And I started to think, well, if this is going on in the body, we really have to combat that level of inflammation. And the best way to do that would be with these wonderful fruits and vegetables that we can put into our mouth and potentially kind of reduce some of that inflammatory effect of endometriosis. And so I really started my push for my patients because of the endometriosis patients and really wanting to kind of prime their body for the best IVF outcome with that diet in mind. And I definitely saw improvements in my patients. But what came to be the first improvement was less pain and feeling better, even before they got pregnant. So it really is. It's such a powerful tool for that component. And then that just spread in my mind because a lot of infertility or any disease process in the body is related to inflammation. And so when they were starting to tell me that they're feeling better as far as their asthma goes and other parts of, what they had problems with, it all made sense. And that just, the light bulb went off for me to make a change.
Well, let's get to your story. What happened that you did make a change?
Well, I was so excited about making this website and telling my patients what foods to eat and just going through all this stuff about, how to reduce the inflammation in the body. And here I am, 7 years in with gout. I have hereditary gout, and my gout was intense. I was getting attacks every 3 to 4 weeks. And as I'm doing this new website after I transitioned out from my partner and went on my own with Nova IVF, I realized, well, I should be doing this because gout is an inflammatory process. And so I went cold turkey about 7 years ago now. And
Mm.
I just went cold turkey completely. And I was enjoying the diet. I was hungry. I was losing some weight. And I'm like, okay, I hope this hunger subsides a little, but I just had to eat a little bit more and it was fine. And then all of a sudden, I'm 6 weeks into this and I hadn't had a gout attack. So that's a couple of weeks longer than my typical pattern. And I just ran it by my primary care MD and I just said, hey, I haven't had a gout attack. And I was on max dose of allopurinol, which is a medication to potentially ward off any gout attacks. And I live with colchicine in my car, which is the medication you take when you get a gout attack. I have it in
Hmm.
my car. I have it in my office. It's like an EpiPen. It's there everywhere, ready to use. That's how bad my gout was.
Wow.
And he said, oh, I think it's probably coincidental. I wouldn't decrease your medication.
Hmm.
So I went another couple of weeks and still nothing. Then I started to wean myself off of the allopurinol and I was off after another 6 weeks. And it's been 7 years since I've had a gout attack. And it's not that my uric acid, which is the component that causes, a high level of uric acid can cause a gout attack.
Hmm.
My uric acid levels have remained high, but I don't have the trigger of inflammation in my joint anymore to get the process started. And so I am living gout free and it's been phenomenal. It was really debilitating for me. And then when my asthma went away and I got off of my inhaler and I'm no longer using any asthma meds, I said, okay, this is real. This is something very powerful.
Now, did you notice anything mentally after you changed to a plant-based diet?
Definitely I was a lot clearer. I wouldn't say that I lived in a fog, but I'm one of those physicians that I like to have a lot of time with my patients. And so I'm connecting to my patients. And sometimes, the exhaustion of that connection at the end of the day just left me a little bit foggy.
Hmm.
It put a lot into my patients. And so sometimes it gets a little bit exhausting on your own body towards the end of the day. And when I made that switch, I had so much more energy. And I'm like, wow, I can do this for many, many more years. I don't have to retire anytime soon. I just had so much more energy for every aspect of my life, especially my patients, but my kids. And, I have a, little hobby vineyard and I had more energy for that. And it was just great. I mean, it's just energy and fog clearing was my biggest, noticeable phenomena after going whole food plant based.
Now, you mentioned that you were hungry. Was there anything that you struggled with when you first became plant-based?
I think for me that hunger, especially when you have a busy day with patients, I never had felt such hunger initially. But what I was doing is I was having kind of similar size meals to when I used to eat kind of nutrition or I should say calorie dense foods.
Hmm.
And I just realized I just needed to have a little bit more fiber and kind of increase that caloric load a little bit more. And then I was fine. Still losing weight. I mean, I think I ended up dropping about 30 pounds. And I was not a overweight individual, but, maybe went from a BMI of, right at about 24 and a half, 25 down to about, 22 and feeling incredible. But now my body settled in and I know how to eat well without any of that hunger issue.
What did you learn from all of that?
What I learned is there's such a great variety of fruits, vegetables, and whole grains that I didn't even tap into. And I love to cook as well. And so now bringing these into the kitchen and starting to explore, I have this phenomenal repertoire of dishes that I make now. And it was helpful because without that, I don't think my kids would have converted to or transition to the whole food plant-based diet. But I started making these wonderful dishes with ingredients that I'd never used before and spices that I had never used. And it opened up my palate completely and really opened my eyes that when I was animal based, it was a very limited number of meals. And now plant based, it's just an expansive number. And that's exactly the opposite of what everybody tells me that's animal based. What do you eat? How do you get your protein?
Mm-hmm.
It's just, there's so many options in the plant world.
Take us back to that feeling that you had when your gout went away. How did that feel?
Oh my gosh. So most of my gout attacks would start at night. And so it would interrupt my sleep. And, granted, it was every, 3 weeks or so, but still when it would come on, it would be like a panic to get the colchicine in, to drink a ton of water and everything. And I think I anticipated it almost every night when I went to bed. And so I went to bed anxious about the gout attack.
Mm-hmm.
And once I realized that I wasn't having them anymore, my sleep became the best. I
Mm-hmm.
just lost all that pre-sleep anxiety and I was able to just crash and wake up and it was like, did I make it through the night again without a gout attack? It was a gift. It was such a gift. I just remember so clearly at the 6 week mark. I'm like, this is crazy. I'm gout free. Well, I was jumping the gun a little, but it turned out to be the case.
Gout is, correct me if I'm wrong, but is that from seafood?
Yeah, they say it's from an excess purine in the diet, but it could be that your body doesn't eliminate the purines, or it could be that you don't or you take in too many. So there's a combination of whether it's elimination or ingestion, but basically that's going to be from there's definitely plant products that have this too, but when you look at it, it's really kind of animal based proteins that are going to give you that high purine level. And the purine is going to be what creates the uric acid in your body. And so it's primarily an animal based issue.
What is one thing that's exciting for you right now in your life?
I think what's so exciting is when I see I have 4 kids, when I see their transition to whole food plant based and knowing what they are doing to their bodies right now in terms of health benefit and what that could do for their overall, health span and lifespan, I feel so excited that they are passing that on to the people around them. And it's this kind of, you tell 2 people, they tell 2 people, and so on and so on. It's just this wave of, kind of waking up to how wonderful this whole food plant based, diet is, not diet, way of life, and what the other potential benefits are in terms of animals and climate change and everything that it's all wrapped in. It's all wrapped in. And
Right.
so I think that I just live with so much excitement and I pass this on to my friends. I actually have this little series that I do with my hobby winery got a little bit bigger. And I'm actually teaching all my friends on a sunset series that I do about a whole food plant-based pairing with wine because I make
Mm,
natural wine. It's very healthy. There's no additives in it. And so I show them that they don't need to have their Cabernet with the steak. You
exactly.
can do a great job with, a mushroom bourgogne or, a nice, barbecue portobello, so it's just kind of waking everybody up and getting them out of that, that habit that we have that, we've learned over and over again through the years that there's only a certain way of doing this, and it's just so nice to kind of break the norms or break the old traditions.
Now, how old are your kids?
So my oldest will be 32 this year, and my baby's 23. They're on their own, and thank goodness when they chose to go on their own, they still kept the whole food plant based way.
Was there any kind of transition when you had them in the house that you struggled with? Because kids always like to go against what the parents want them to do. So, was there any kind of struggle that you had with them at any time?
I think my kids were they were older when this happened. So, if it's 7 years now, my son was already out of the house, my oldest,
Hmm.
and my baby was still was in high school. She was the easiest. My youngest was the easiest. I swear she's a fruitarian. She just loves fruit and vegetables, and she never ate red meat. She hated chicken, and she doesn't like seafood. So occasionally she'd have, a little pork, and it just she was easy. She just transitioned right away. My other kids were a lot more skeptical,
Hmm.
and maybe because they were older, but they didn't want to give up what they thought was, good protein sources. They're all active. My daughter played collegiate soccer. My son loved soccer, and so they all wanted their protein sources. And it was just teaching them that they could get great protein, and that we don't need that much protein in our diet. Everybody thinks that we need all these grams. Even the bodybuilders, yeah, I got to have my 1.5, 2, 3 grams per kilogram. No, we don't need that much protein in our body. It's actually much better for our body if we don't have it. So once they learn that, with resistance initially, they kind of said, "Yeah, no, I don't need to do animal products anymore."
Let's shift gears over to the winery. Why don't you tell us about
Hmm.
that?
Yeah, so I had a very dear friend that passed away in 2008, and we had both talked about putting in some grapevines because we both like to farm. We have our vegetable gardens, we have competing tomato contest, and it's just years and years of a lot of fun with him. And we decided that we would put in a little vineyard, and we talked about it for years and years. And then he got colon cancer, and he passed away several years after the diagnosis. And we never got to that point. So I just said, no, it's time to put it in. Life's too short. So put in the small little red, varietals only, all styled after the Bordeaux wine. So Cabernet Sauvignon, Cabernet Franc, Merlot, Malbec, Petit Verdot. And so I put these vines in. I was so excited. And I'm like, yeah, I'm going to make wine one day. Of course, it takes about 3 to 5 years to start to get your first harvest. So it didn't happen immediately. But in the process of doing that, I found I just loved, being out in nature with, creating the vineyard. And I grew this vineyard from the 455 original plants now to 14,000 plants. And I'm just so excited because now I'm making wine. I don't add anything to it. It's kind of in the same don't have processed food. I don't want to put anything in my wine. So I don't add anything to it. And it's considered technically natural wine, no additives whatsoever. And I honestly feel that it's so much better. And even those friends that used to get headaches when they drank red wine, they say, I don't get headaches when I drink your wine. It's awesome. And I said, yeah, because there's no additives in it.
Mm,
So super fun.
I got to drink some of that. No
Yeah, no,
headaches.
no, I'd
I
be
think you
happy.
got something
Well,
there.
to a degree. Everything in moderation now. Uh,
Now, how did you come to the conclusion that being plant-based helps with fertility?
so it was in the context of those endometriosis patients, and there's been a lot of work about endometriosis and potential markers for inflammation inside the uterus and how that can affect an implantation of a very healthy embryo otherwise, and just showing that any reduction in that inflammatory process can actually enhance the implantation. So there are many different studies that look at all different aspects of inflammation, and there's a lot of energy around this, and a lot of it deals with the gut microbiome and trying to optimize that. But what I found in my patients when I really counseled them about whole food plant based and decreasing the inflammation, their symptoms did get better with endometriosis. But unfortunately, I have a small clinic, so it's more anecdotal to see that the pregnancy rate actually dramatically improved. And so I just know that we walk around with inflammation in our body. And if we're not constantly kind of recharging the antioxidant battery, we are going to be inflammatory. And
Hmm.
whether that's, just the foods we eat, but also, just conditions. We know that, any patients with obesity, and I'm very concerned about obesity for both male female infertility because the level of something called C-reactive protein, which is a marker for inflammation in the body, is so much higher in obese patients. And so I really counsel them, one thing you can do, it's tough to lose weight, I know, but at least we can start to work on that inflammation by getting more antioxidants in your body. And it works. It works. But then they start to lose weight on it too. And then they're like, wow, this is great. I'm getting rid of inflammation and I'm losing weight. So it really was learning that my endometriosis patients can do much better on a whole food plant-based diet in their outcome.
Do you have specific examples of patient stories?
I do. I have, a lot of patients that have adopted a whole food plant-based, and some I swear would never have gotten pregnant. And I wish the medical community was more receptive to this, but I can't even get my own doctors to be receptive of diet. But I definitely have cases where the level of inflammation was so high, and once we switched them over and got them, 3 months in on a whole food plant based diet, they had success. It's so exciting.
Now, your approach seems very selfless. You seem to be more interested in your patient's health and happiness than you are making money, because if we come right down to it, you could probably make a very successful business just being an IVF doctor. What is it about your patient's health that is so important to you?
I don't know if it's a societal obligation or what it is. I mean, obviously, I love kids. I had 4 kids, and they're my whole life. But knowing how important that experience has been for me, when I see my patients, and maybe I don't see the best habits going on, and I really want to kind of just tickle them a little to consider the possibility of changing their diet. And I'm not gonna force it at them, but I'm really gonna try to explain the benefits of why it would be beneficial to their fertility journey. But more importantly, I want my patients to have a baby. I want that more than anything. But I also want them to be grandparents.
Mm.
Well, I mean, we have patients in their mid 30s and 40s. I mean, that means that when their kid graduates from high school, they're going to be in their 50s to 60s. Well, I mean, they gotta change their path if they want to be around for these major life events later on, like high school graduation, like college graduation, weddings, and grandkids. And so I feel, and I tell my patients this every single new patient consultation, this isn't about the here and now and getting you pregnant. This is about the big journey of what's best for you and these kids and grandkids going forward is to have you around in a healthy way. And so it's just, so I don't know, maybe it is. I just want to do what I can in my little corner of the world to be sure that these patients who are going to become wonderful parents are around for a very, very long time for both their kids and their grandkids, because I think that would just make society a lot better.
What is it about helping people have babies that makes you so passionate?
I I remember the first ultrasound I did, and this is back when ultrasounds were just coming out. We didn't
Hmm.
have, I mean, this is in the 80s. So when I saw that heartbeat for the first time with the patient, first time seeing their baby and that heart beating, I just, I melted. And it coincidentally was right around the time that, I was going to have my first child. And so I was kind of wrapped up in that whole feeling, but seeing that joy in my patient's eyes, I just forever, I was happy being an OBGYN, and that immediately started to transition me towards the reproductive endocrinology side and infertility so I could help my patients on that journey. I mean, I love delivering babies. That was phenomenal, but now I wanted to help even earlier and get them to that point of being a parent. And I'll never forget that first ultrasound and how it just, it's ingrained in me. And that emotional feeling just floods back every time I think of that patient or, the couple. And it's just, yeah. I mean, I would say the name, but it's, private medical information.
Right.
But I mean, it's just right there, ready to come out. And her smile and her tears, it just was amazing.
How does that make you feel when that happens?
I just, I'm, I'm here to serve my patients. And if I can be the link between a beautiful couple or a person wanting a baby and then achieving that, and I can just maybe be the enzyme to make that, reaction happen, I feel so honored. It's such a difficult time in a person's life or a patient's life when they're going through the fertility journey. And I am honored that they let me in on that journey. I am beyond humbled beyond all, considerations, because people don't want to share that part of their life. It's a very sensitive part of their life. I mean,
Mm.
it involves a lot of discussion that is not going to come up, even with very good friends. And so for me to be let in, it's just an honor.
Can you tell us the typical patient experience at Nova IVF? Like, what can a person expect?
Our patients come in, and I have a wonderful work partner, Dr. Shah, who has the same, and it took me forever to find somebody with a bedside manner that I liked like that. And so patients come in, and what we want them to know is that we hear them. We want them to tell us what their concerns are and what they would like for a family,
Mm-hmm.
and then really work with them. There's, emotional difficulties, there's going to be financial constraints, there's going to be so many things, but to try to figure out a plan that's going to work best for them to help them get to their ideal goal of what they define as a family. And so it really is, it's a lot of, you know, touch care. I have a great team. We're there. We're present all the time. Patients will always receive a pickup of the phone. They never get a voicemail. It's just, it's really just being there at a time when they need us most. And our patients uniformly, even if they don't get pregnant, uniformly leave Nova saying it was the best medical experience they've ever had because they've never felt so cared for. And that's real. That's how we want to deliver care. And sometimes in a world where care seems so kind of automated and, processed, we just want to break that mold and really give our patients that human touch.
Are there any trends that you are concerned about in the fertility of your patients?
Yeah, actually, one of the trends that I'm a little bit alarmed about is the what has been shown to be a decreasing sperm count and morphology, which is the shape of the sperm. And we call it the normal morphology when it's good. So that number has been going down. It's about the last 40 to 50 years that several analyses, or what they call them, is meta analyses, so multiple studies put into one, that they've looked at these trends. And it does appear that there's been a 40 to 50% drop in these numbers, both sperm concentration and normal morphology. That coincidentally coincides with the rise in processed food, and where I know we need a lot more research to tease out what's actually going on here. It just is, I think it's so important for patients to be aware that there's so many things in the diet and in the environment in general that could affect gametes. Gametes are so sensitive, whether that be eggs or sperm.
Mm-hmm.
And with that sensitivity, we have to be just so mindful of what could be going on with a less than ideal diet choice and maybe a lack of antioxidants. So to kind of resist that trend, that's even more powerful for my male patients and my female patients, but to really consider, and they have shown that a higher level of antioxidants does improve the sperm. But I don't want my patients to take supplements. I want them to get it from food. And so if they can make that 9 to 11 servings of fruits and vegetables a day as a minimum and keep that fiber load up to take out the excess hormone, then I think they're going to be in great shape to hopefully optimize their fertility.
Now, are there certain antioxidants that you feel work better than others?
I think it's always like you want to have everything in moderation. It's the combination. I mean, you're going to get, the carotenoids are going to be phenomenal. Lycopenes are going to be great. So you're talking about, carrots and tomatoes and, all the colored fruits and vegetables, all the anthocyanins and blueberries and blackberries. You just want to mix it up. And it's true. You want to eat the rainbow, but you want to eat the rainbow in both fruits and vegetables. It's just such a phenomenal powerhouse of, these flavonols and anthocyanins that we need to be feeding our body to maximize that gamete health, the gamete being sperm and egg.
If you are eating well, like you go to Nova and you counsel them on eating a plant-based diet and that doesn't work, at what point do you decide to go to IVF?
Some patients will come in with, what we would say kind of a soft infertility diagnosis. And so that's when we really counsel them for potentially making a lot of changes. All patients get counseling on the importance of diet. I mean, I have all the brochures from Physicians Committee for Responsible Medicine. I have books that I hand out to patients, whether it's the China study or How Not to Diet or How Not to Die by Michael Greger. I mean, we give these books away. I want my patients to read, and come back with questions. But if it's a soft call and we feel like they're young enough that they won't lose valuable time while they try a little bit longer, then we start with that. We start with, cycle timing and eating healthier, exercise, good sleep, good hydration, the cornerstones of healthy living. If we know, like, there's block tubes or there's a male factor where there's barely enough sperm to even see it on an analysis, then we have to move towards IVF or other treatments.
Are there any risks associated with IVF?
IVF definitely has risk associated with it. The biggest risk is when we will transfer more than one embryo. Multiple gestation is not as good as a singleton pregnancy. And so we see a lot more complications when we have twins, or if it's even more than that, triplets or more. It's just a very high risk pregnancy. So the biggest risk in the IVF is going to be the multiple pregnancy. There are definitely risk in the stimulation. Patients can get overstimulated. We call it hyperstimulation syndrome. Fortunately, with the changes in the medications, that has decreased quite a bit. And there's minor risk. There's always a risk of bleeding infection, but those are very minor. What I'm more concerned about is we do know that there appears to be slightly higher rates of pregnancy complications, whether that be preterm delivery or low birth weight, very slight. And in some cases, when we transition and we do a frozen embryo transfer instead of a fresh transfer, we don't see that as much. So it could be related to the high hormones of stimulation. But overall, the risk of IVF is minimal. Fortunately, the biggest risk is avoiding that multiple pregnancy and doing everything we can to minimize that risk.
How many eggs do you transfer after fertilization?
So once the eggs are fertilized, we call them embryos, and then we will transfer most of the time just a single embryo. And that's because we don't want to have that risk for twins. Now, occasionally we'll transfer a single embryo and it splits into an identical. That we can't do too much about. And it's actually higher than the normal identical rate, which is about 0.4% in the population. It's at least double that, if not triple that. So there is something about the IVF, whether it's epigenetic, we don't know, but there's something that increases the identical twin rate.
With IVF, are there certain percentages for girl babies versus boy babies?
There was a lot of discussion about this and which method of fertilization could increase the chance for having a boy or girl. And it comes down to it's a coin toss, just like it is in, natural intercourse. There really isn't any preferential for X or Y sperm and, getting that boy or a girl. So it's 50-50.
Finally, Can you give me one word to describe how you felt before you were vegan, and one word to describe how you feel now that you are vegan?
I would say, and this is based on the lack of knowledge that I had about diet, because in medical school we don't receive any, and we never received any nutritional counseling, but certainly not on diet recommendations. And so I would say, because of my recommendations being that way, I would say haphazard would be the word that I would use for my pre whole food plant based, and then I would say, if I can make it one word, directionally purposeful, or certainly purposeful for after. I just feel I have so much to give patients, family members, and friends about the wonders of a whole food plant-based diet. And I want them to experience that health span that we should all have. It should be a health span, not a lifespan. It should be a health span. And that hopefully will correlate with the lifespan.
It's such a pleasure speaking with you. Thank you so much for taking the time. What is the best way for people to get in touch with you?
Yes, so we have Instagram and Facebook, but our website is Nova IVF, and the whole plant-based and natural wine and pairing is at Moose Mountain Vineyards. And so my dual career, I grow things, babies and vines, and make wine.
Thanks again, Rich, for being on Plant Your Seed.
Thank you, Fred. I really enjoyed it, and it's just an honor to be on your podcast.
Hope you are inspired by this story, and remember, it's never too late to plant your seed. Links to everything we talked about on the podcast can be found on Instagram at plant.yourseed in the show notes tab in the bio. If you enjoyed the show, remember to leave us a review, and until next time, thank you for listening.